Hello everyone, my name is Lata Kona. I have prepared this presentation on a case study conducted for HAP725 Statistical Process Control course at George Mason University taught by Dr. Maria Uriu. This study was focused on heart care related performance and overall hospital rating care transition at Mary Washington Hospital in Virginia compared to its competitors. Data used for analysis was obtained from Centers for Medicare and Medicaid Services Hospital Compared Data Archives. The hospital chosen to review was Mary Washington Hospital, which is located at Fredericksburg, Virginia. It has a Google rating of 2.2 with 698 reviews. Its rating on CMS is 2 for overall star rating, and patient survey rating is also 2. Its rating on Yelp is 2 with 132 reviews. These are the measures that I have selected for my case study. The first one is hospital return days for heart attack patients, which tracks the number of days heart attack patients return to the hospital after their initial admission from the same condition. And the second one is heart failure 30-day readmission rate, which is the percentage of patients who are readmitted to a hospital within 30 days of being discharged after an initial admission for heart failure. The third one is death rate for heart failure patients, which represents the proportion of individuals with heart failure who die within a specific time frame. And the next one is the overall hospital rating, which provides a comprehensive summary of the quality of care delivered by the hospital. And the fifth one is care transition, which evaluates the effectiveness of the transition process when patients move from one care setting to another. So the next question is why these measures? So the hospital return days for heart attack patients is of paramount importance as it indicates the effectiveness of the treatment and follow-up care provided in preventing further complications. Heart failure readmission rate is significant because it directly correlates with enhancing the overall patient experience. A lower readmission rate suggests that patients' needs were well addressed during their initial hospital stay and they received appropriate follow-up care, aligning with patient-centered care principles. The death rate of heart failure patients is critical as it reflects the ultimate goal of improving patient outcomes and their overall quality of life. The overall hospital rating provides a comprehensive summary of the quality of care delivered by the hospital. It supports transparency, accountability, and data-driven decision-making, which are essential elements for continuous quality improvement efforts. Care transition is another important quality measure. When focused on its improvement, it can lead to better patient outcomes and experiences. The hospital competitors that were selected and compared with Mary Washington Hospital are Spotsylvania Regional Medical Center, which is located at Fredericksburg, Virginia. It has a Google rating of 4.1 with 2,236 Google reviews. The second one is Stafford Hospital LLC, which is located at Stafford, Virginia, with 2.8 Google rating and 206 Google reviews. And the third one is Santara Northern Virginia Medical Center, located at Woodbridge, Virginia. It has Google rating of 2.1 with 703 Google reviews. The next question is why these hospitals? Hospitals in Virginia were selected to analyze the quality of heart treatment received by patients. The limitations are unavailable data for specific years. For instance, the data for the year 2020 is missing for hospital return days measure, and the data for the year 2021 is missing for heart failure readmission rate. And the other limitation is measures with different time frames. For say death rate time frame is 2 years in some data sets and it's 3 years in some other data sets. The control charts that I'm going to discuss further have upper control limit and the lower control limit, which is represented by red lines. It also has a selected measure for Mary Washington Hospital, which is represented in blue line. This is the control chart for hospital return days for heart attack patients and is within the control limits. However, we can see there is an increase in trend from 2017 to 2021, suggesting that hospital return days for heart attack patients is increasing over time. Heart failure readmission rate is out of the control limit, indicating a special cause variation. It also suggests that readmission rate has increased over time from 2017 to 2020. Death rate of heart failure patients is within the control limits. It has increased from the initial time frame to the second time frame, and in the last time frame it has decreased. The overall hospital rating is fluctuating over time and is out of the lower control limit in the year 2021, indicating a special cause variation. Um, the K transition has also decreased over time and is out of the lower control limit, indicating a special cause variation. Overall, in comparison to other hospitals in Virginia, Mary Washington Hospital has performed well with respect to death rate. However, it has to focus on readmission rate, overall hospital rating, and care transition as they are out of the control limits, and also the care transition hospital rating is decreasing over time. And the suggestions I have is to consider specific training programs to address areas affecting patient care and satisfaction, and suggest any strategies to actively engage patients in their care, implement feedback mechanisms to address patient concerns and improve overall patient experience. This concludes my presentation. Thank you for your time.